So I recently had a friend ask me about high blood pressure and yoga. So if we look at what you're trying to resolve when you have high blood pressure, you're trying to reduce stress and improve circulation. So yoga generally is very good at those things. Typically you can use postures, so asanas, pranayama, breath control, and meditation, and all of those three combined will help you improve circulation and reduce stress. The key thing from a posture point of view is just to mention that you should not be doing any postures where your head is below your heart. So inversions like headstands, shoulder stands, and even downward facing dog should be avoided because they actually are counterindications for people with high blood pressure. The one thing I wanted to focus on today is a pranayama, a breath control practice. It's a very simple exercise and it's very good at improving circulation. So it's called alternate nostril breathing. From a Sanskrit point of view, it's called Nadi Shoudana or Nadi Suddhi. Sometimes it's also called Anuloma Viloma. That's primarily when it's used without counts, and today we're going to be using counts. So we're going to be counting with our breath. Very simply, just as far as counterindications for this actual exercise, if you have a cold or any respiratory condition, go very easy with this, or if it's a serious respiratory condition such as asthma, check with your GP before you do this. So very simply, we're going to be breathing through our left and our right nostril alternately. We exhale through our left nostril as the first count. We also always end through our left nostril as the last count. From a yogi point of view, that's all about balancing out the energy. So the Surya and Chakra nadris, which are the energy channels running through the body. So the other thing to mention, even if you're not too fussed about balancing out the yogic energy point of view, it just gives you a good base to start and finish. So we're going to start by cleansing our nostrils first of all. So you might have a tissue to do this. But one very easy way is just to bring your hand up to your forehead. So this is what's called a mudra, a hand lock. We're going to use our middle finger and our index finger just to push into our forehead. The thumb is going to be used to close the right nostril, and the ring finger or the little finger to close the left nostril. The posture here should be nice and straight. You can be sat on the floor in a full lotus, half lotus, comfortable cross-legged position, or just as I am, sat on a chair. The key thing when you're doing this is to make sure you have a nice straight posture, so clear air passage, and also maintaining a clear channel for the energy chakras moving up and down the nadis so that there's no kinks in that energy channel. So we're going to start just simply by doing 10 quick breaths in and out, cleansing the left nostril. And then change left nostril and breathing in and out through the right nostril. So immediately you should start just to feel the sensation. You'll feel as if you're breathing into parts of your head that don't normally get oxygenated. So it's a nice tingling sensation. And this really starts to, I guess, express some of the benefits. So through this deep breathing, it really helps the lungs in blood purification. So the whole blood gets purified, essentially. It improves blood circulation to all parts of the body. As I mentioned earlier, from an energy point of view, it balances the left and the right, so Surya and Chakra nadris. And that really creates a balance between the body, mind, and the soul. And for all breathing exercises above the throat, there's a big focus on benefits for conditions such as migraine, sinusitis, and asthma. And one other thing to mention from a meditation point of view, if you're doing this breath work, as we will do as we now continue on to the exercise, if you're doing it quietly, so when you're breathing in silence, that really aids you to have focus and concentration. So we're going to start the actual pranayama now. What we're going to be doing is exhaling for a count of 4, inhaling for a count of 4, then changing nostrils and doing the same on the other side. So we start by coming into Vishnu Mudra. Make sure your elbow isn't collapsing into the lung. You want to have a nice clear air passage here, so not collapsing the right lung. Close the right nostril, softly close the eyes, and exhale for 4. Inhale for 4. Close the left nostril, and exhale for 4. Inhale for 4. Close the right nostril, and exhale for 4. Inhale for 4. Close the left nostril, open the right, exhale for 4. And inhale for 4. Close the right nostril, open the left. Exhale all the air out. Now breathe through both nostrils. Open the eyes. So that really is an introduction, a very, very short Nadi Shoudana. So ideally what you should be looking to do initially is do that for around a count of 1 minute, then build it up over a couple of weeks up to about 5 minutes. Once you're comfortable with doing that for 5 minutes, the focus is to change the count. So within yogic breathing, the focus is generally on the exhale, because in day-to-day breathing and normal breathing, we're focusing on the inhale. What we want to do is reverse that, so really just cleanse out the system, so focus on getting rid of toxins and carbon dioxide. So we want to double the amount for the exhale. So the next step, once you're happy with counting 4-4 for up to 5 minutes, is to exhale for a count of 8, inhale for a count of 4. And then again, repeat that for a minute, and then over a period of a couple of weeks, move that up to about 5 minutes. There are advanced stages of doing this using retention, but for now, let's keep it nice and simple. Enjoy the pranayama. Namaste. Thank you.